We've been working on this story for the last several weeks. We started with a question. Are there a lot of people suffering from a mental illness and not getting treatment, maybe not even have a diagnosis? Could someone you pass on the street be living on the edge and you wouldn't even know it? But as 15 Finds Out started asking questions, we discovered those answers are not so simple. They're shocking, tragic. When public displays of violence happen, they grip the nation. Everyone wants to find a way to prevent another one from happening. Many times, blame for the shooting is put on mental illness. Reports suggest that in the mass shooting since 1970, around 60% of the perpetrators showed symptoms of depression, delusions, and paranoia.
Could there be people who could be walking down the street next to you ready to commit a violent act and we don't know it?
We probably have always had that situation. Are they mentally ill? No.
In fact, 15 Finds Out discovered from source after source linking mental illness as a root cause of mass shootings is oversimplifying it and can be misleading.
What we don't want to start to say is that those with mental illness are then more likely to commit violent acts. In fact, that's not the case.
A 2001 study of 34 adolescent mass murderers found most were described as loners and abused drugs or alcohol. Half were bullied and fantasized about violence. But only 23% had a documented psychiatric history. 6% deemed psychotic when they committed their crime. Forensic psychologist Dr. Stephen Ross.
There are some folks who have done mass shootings, who have killed people. I think they may not be mentally ill, but they're socially and morally depraved.
It's estimated only 3 to 5% of violent acts are committed by someone with a serious mental illness.
We're talking about a very small section of people that have a mental illness and we have seen that have gone out and have been violent to other people. If you have a serious mental illness, you're most likely to hurt yourself and not another person.
Nationally, there are around 15,000 homicides a year, less than half of the 35,000 suicides. In Allen County, so far this year, there have been 28 homicides and 36 suicides. Research shows 90% of people who commit suicide had a mental illness.
People do get better, but there needs to be help.
Getting that help sometimes is a challenge. Through the course of our investigation, 15 Finds Out discovered while a vast majority of people with a serious mental illness, like schizophrenia or bipolar disorder, do find their way to treatment, in some cases, it takes up to a decade to get there.
I'll have people come in when they're 16 years old, and this problem's been going on for 10 years, and nothing was done about it.
Is the healthcare system working?
There are opportunities for people to get help. It is sometimes fragmented. I think part of that has to do with the fact that we don't have enough resources. If you look at the funding cuts at the federal and state level over the last decade, you can see why we're not always working smoothly to get people into services and to help maintain their services.
Those cuts have eliminated a lot of long-term care facilities. Most people do well with community-based treatment, but the National Alliance on Mental Illness Fort Wayne president says for some more severe cases, a few days in a hospital isn't always enough. But sometimes just getting in the door for treatment is the biggest hurdle.
There's people who are concerned about the safety of someone in the community, and there's not an easy way to get them treatment. We have a number of system problems and challenges that are not really helping families and people with a mental illness.
What needs to happen to change that? I mean, where does that responsibility lie?
From the top down, from the government, a challenge is all of these different pieces and parts within the healthcare. So you have your psychiatrist, that's just one thing. You've got a hospital, that's a different thing, and pharmacy is a different thing.
How do we help people get treatment that's accessible, affordable, and acceptable? And that's where we need to start. It doesn't matter whether we're talking about a violent act or just the health and well-being of an individual. we need to make sure that people can access care.
Fort Wayne actually does have a lot of resources to help people work through mental health issues. This is the National Suicide Hotline on your screen right now if you or someone you know needs help. You can also find a lot of links and phone numbers right now in this story on the 15 Finds Out page. That includes some links to some screening tests for several different mental illnesses.
And Alyssa, you also discovered there's a new task force involved here.
That's right. In Allen County, there's a new task force working to make getting that care easier, more streamlined, kind of putting all the resources in one place. We'll take a look at their efforts and how they're actually trying to change the community conversation. That's tomorrow at 6 o'clock when On the Edge continues.
Sounds like that is much needed.
It is.
Okay, thanks, Alyssa.